Welcome back. Lung cancer remains the leading cause of cancer death in the United States. Only 27% of cases are actually caught early. But this morning, we're talking with experts at Johns Hopkins about how biomarker testing could help catch the disease earlier. So joining me now is Dr. Julie Bramer, medical oncologist at Johns Hopkins, and Colette Smith, a patient living with lung cancer. Thank you so much for being here. Dr. Bramer, I want to start with you. Before we talk about the specific test that you're working on, tell people who may not be familiar what a biomarker actually is.
So a biomarker is actually a test that's done on a cancer biopsy to try to help us figure out how best to treat the cancer itself.
Actual test that please speak to me a little bit about the actual test you're working on right now.
So the actual test we're talking about today is PD-L1. This test detects the protein on a cell surface, and PD-L1 is used by cancer in order to make itself invisible to your immune system. And it's kind of like an invisibility cloak. And drugs have been developed in order to block that and allow your immune system to actually recognize the cancer.
Wow, pretty impressive. Colette, if we talk to you a little bit, tell us about your cancer and how this test and how this has been able to help you.
Yes, I'm an 11-year lung cancer survivor, and I'm proof that screening and early detection saves lives because I'm currently living with no evidence of disease. I did not have the PD-L1 testing, but I know the mutation of my cancer, and through that, my doctors were able to devise a precise treatment plan, and that included removing my upper left lung.
Well, that's fantastic. How do you feel like you learned to advocate yourself when you realized maybe something was missing in your care?
I learned to speak up and ask questions, even if I were uncomfortable with the questions. And that is what actually saved my life. I pushed for answers. And when I was not getting the answers that I deserved, I changed my treatment team.
And doctor, what should patients be asking their doctor to make sure that this is part of their plan?
So I think when you're first diagnosed with lung cancer, you want to ask several questions. One, what stage is the lung cancer? What type of lung cancer do I have? And then what biomarker testing has been run on that biopsy that was performed? And those biomarker tests should include mutation testing as well as PD-L1 testing in order to figure out how best to treat. And so you want to ask your physician about how do you use those biomarkers in order to figure out what is the best treatment that you should start with.
A really good information. And is this something that should be available at most hospitals?
Yes, this is standard treatment and should be available at all hospitals.
Really good information. Thank you so much. One quick question for everyone out there. You don't have to be a smoker to get lung cancer, oftentimes a misconception. So what do we need to know about early detection? How do we advocate for ourselves on that end?
So whether you're a smoker or a never smoker, if you develop symptoms such as cough, shortness of breath, chest pain, you should ask about whether or not this could be lung cancer. And definitely if you are a smoker or were a smoker, how does lung cancer screening actually fit into how I'm screened for cancers?
All right. Thank you both for being here. Thank you for your information, of course, as a doctor and then as a patient who has gone through all of this. Appreciate it. You can get more information on our website, or if you want to watch this interview again, go to WPBF.com, or you can download our free mobile app.